The most complete information about the patient will be obtained through the use of an assessment instrument specific to the geriatric population, which includes information about both medical diagnosis and treatments and about functional health patterns and abilities. The plan of care for older adults should be individualized and based on patients' current functional abilities. A standardized geriatric nursing care plan will not address individual patient needs and strengths. A patient's need for discharge to a long care facility is variable, so the activity level should be designed to allow the patient to retain functional abilities while hospitalized and also to follow any additional rest needed for recovery from the acute process. A review of the chart, interviews of the patient and caregiver, and written information by the patient will all be included in the comprehensive assessment. The initial action should be assessment and interviewing of the patient, and if the patient is acutely ill, the physical assessment should be accomplished first to detect any physiological changes that require immediate action. It is recommended to interview the patient alone if there is any evidence of abuse, because it is important to collect and document physiological data before notifying the Protective Services Agency. The patient will most likely give inaccurate information if the abuser is present. The most information about drug use and possible interactions is obtained when the patient brings all prescribed medications, over-the-counter medications, and supplements to every healthcare appointment. Explain to the patient that over-the-counter medications must be discussed with the healthcare provider, and all medications should be prescribed from the same pharmacy to help prevent drug interactions. This would involve asking about supplements and herbal medications. Assisted devices should be in place before assessing the patient to minimize anxiety and confusion. Not all older patients have hearing deficits, and it's insensitive of the nurse to speak loudly and slowly to all older patients. To avoid tiring the patient, much of the medical history can be obtained from medical records. A patient's functional abilities, rather than the presence of acute and chronic illness, are more useful in determining how well the patient might adapt to an assisted living situation. Funding from the Federal Administration on Aging is channeled through the local area agencies on aging to provide a community service to older adults. Medicare, Medicaid, and insurers provide funding for specific medical services, but not for needs such as shopping or transportation. Transportation can be a barrier to accessing health services in rural areas. Medications may be able to be sent via mail to patients in rural areas, however, may be unable to purchase large quantities of medications for fear of theft or diversion. The patient living in a rural area may lose the benefits of a familiar situation and social support by moving to an urban area. Listed here are several characteristics of treatment regimens. Other examples include treating pain prior to physical assessment. Osteoarthritis is not an acute issue. This is a chronic problem that requires long-term interventions such as physical therapy. Hyperglycemia and hypoglycemia are chronic illnesses that the patient must be instructed on how to recognize signs and symptoms. Restraints are usually the last option. Chair alarms or bed alarms should be considered a first choice. Active range of motion is helpful in improving strength and endurance. Inactivity and immobility rapidly lead to loss of function in older adults. The nurse should develop a plan to prevent further deconditioning and restore functioning for the patient. Since forgetting to take medications is a common cause of medication errors in older adults, the use of medication reminder devices is helpful when older adults have multiple medications to take. The use of memory devices to assist with safe medication administration is recommended for older adults. However, if a patient has a cognitive issue like Alzheimer's disease, it is better to teach the family to give the medication. In the frail elderly patient, nutrition is frequently compromised, and the nurse's initial action should be to assess the patient's nutritional status. A multidisciplinary approach, including social services, is needed when caring for homeless adults. Issues with the homeless population include shelter, supplies, transportation. Many fail to keep appointments for outpatient services because of fear of institutionalization or lack of transportation.